Behind every scar is an untold story of pain. Join me, Boari Michelle, on Focus on Health, a show that creates awareness on various illnesses in our country. Today we take you through cardiothoracic surgery with the amazing Dr. Ruturi from Nairobi West Hospital. But first, I'll leave you with the feature of the day.
The term cardiothoracic means pertaining to the heart and chest. In general, cardiothoracic surgeons are accomplished in the surgical treatment of the chest, including the heart, structure of the chest, and lungs. They may treat cancer, injuries, diseases, obtain biopsies, perform open heart procedures, and if they are highly specialized, may even perform heart and lung transplant procedures. Some cardiothoracic surgeons specialize and others have a more generalized practice. They may perform open heart surgeries, or they may choose to perform lung procedures, or may perform a combination of many types of these.
Thank you very much, Dr. It is great having you here.
Thank you.
So, Dr. Today we're talking about cardiothoracic surgery. Would you brief us on the meaning of open heart surgery?
Okay. Before we go to open heart surgery, I think I would just briefly talk about what cardiac disease in general is. Okay. So there are mainly two main broad divisions of cardiac disease. There's what you're born with, which you call congenital heart disease, and there's what comes later, what we call acquired heart disease. And congenital heart disease is what you hear about common, is basically what a baby is born with. It's a developmental deformity that occurs in a baby. After they're born, it becomes more obvious. And the most common ones are the ones that give you what we call blue baby syndrome kind of complexes, because those ones are the ones where children don't grow well because they have too much deoxygenated blood circulating in their bodies. And the common one that we see in this country is what we call the hole in the heart. Now, breaking it further down, there are different holes in the heart, and those ones we are routinely able to repair in this country comfortably. Now, the acquired one, the common one that you hear about a lot, is what we call the rheumatic heart disease. And rheumatic heart disease is a syndrome that is a complex of diseases in the heart that come about secondarily due to frequent throat infections. Children, mostly when they're younger, they get frequent throat infections, and the bacteria that cause these throat infections is very, very similar to the character to the heart valves. So what happens? The body, as it's fighting this bacteria, starts attacking the valves. And those valves then get damaged. And then from the damage of the valves, from the rheumatic process, the scarring and the narrowing of the valves, then we get valvular heart disease. And the valvular heart disease processes require us to replace the valve. And most of the time, you may repair what is called the mitral valve, which is common. We get mitral stenosis. But also we end up repairing the aortic valve. Most of the time, those are the two valves that we tend to deal with in terms of repair or replacement. When we replace them, we put a metallic valve. That's what open heart surgery basically involves. However, there's another complex of diseases that we call coronary artery disease. Okay. It's now become more common in this country with westernization and Western diets. We're talking a lot about the lack of exercise, lack of physical activity, obesity. And so we're getting a lot more of arteriosclerosis and changes within the heart that cause the heart to start getting problems. You see, the heart is a muscle. And like all muscle, the heart has blood vessels on it. And so those blood vessels sometimes narrow, and that's when you get a heart attack. If it blocks suddenly, then your heart gets, and you see people have, you can even cause sudden death. And for those ones, what we normally do what is called coronary artery bypass. We've done quite a number of cases here. You take a vessel from elsewhere, and you replace bypassing that narrow segment.
You take a vessel from any part?
There's some parts of the body that we routinely take. There's a vessel that runs on the inside of your chest that we deliver, we manipulate it to come down, and you swing that vessel down to attach onto the muscle of the heart. And then you take sometimes veins from the leg, and those veins you make them into a tube, and then those tubes you connect them to the aorta and take them around the heart. So it becomes like a bypass procedure. So you're creating, sort of like fixing new vessels, bypassing the narrow segment of heart. Okay. So the complexity of open heart surgery and what makes it more difficult is the fact that we involve a huge team, because you're talking about operating on an organ that moves. From before you're born, the organ is moving throughout.
Yeah.
Okay? Not only is it moving, it's full of fluid.
So during the surgery, you stop it?
You have to stop it.
Okay.
That's the only way to operate on it. Of course, there are procedures where you don't stop it. But a lot of times you have to stop it because you have to operate on it. Now it's moving around, so you have to stop it. And one of the things we do is we stop the heart. And if we stop your heart, you will die. So we have to now get another team we call perfusionists who run what we call a heart-lung machine. And the heart-lung machine is the one that you connect the body to, and it takes the blood back and oxygenates the blood, warms it or cools it, and cleans it up, and then brings it back to the heart. So the first part of any operation that we do, apart from obviously splitting the sternum with a saw and opening up the chest, is connecting you with pipes to this machine. One pipe takes blood away, and then another pipe brings blood back to you.
At this time of the surgery, is the patient unconscious?
It's deep anesthesia, very deep anesthesia. So at that time of the surgery, I have to have a very good team of people, the perfusionists, who are now keeping that patient alive for me as I'm carrying on the operation, because the heart has stopped. Okay, that's the other thing. So two things. So this thing does two things. So not only do I stop the heart, but also the heart is empty now. Yeah, because we've taken all the fluid out. So the blood is bypassing.
What is pumping the heart right
Is the machine. It's called the heart-lung machine. Yeah, it's one of the big machines inside the theater there. It's a very expensive piece of equipment, and it actually does a wonderful job of taking care and controlling the homeostasis and everything to do with the patient while we operate. Okay. When we are done with the surgery, you close up the patient and now disconnect the patient. Okay. Yeah, and then you're done.
So, Dr. Apart from open heart surgery, what other heart surgeries do we have?
There's what we call the closed heart procedures. Now, closed heart procedures refer to any procedure. It's basically just a division which refers to which patient needs the machine, which patient doesn't need the machine. Any case that needs the heart-lung machine, we call it open heart surgery. Okay? Because most of the time, invariably, you'll open the heart. But the fact that you're connecting the patient to those pumps, and you have to make holes in the heart to take blood out. So that is open heart surgery. Now, one of the common ones we do, which is not open heart, is what we call ligation of arteriosus, patent ductus arteriosus. Now, there's a vessel, when you're in your mom's womb, you don't need to breathe. So your blood doesn't need to go to your lungs. So there's a vessel that bypasses the blood not to go to the lungs. So blood comes from your mom to your heart, but then it goes back to your body without going to your lungs. That connection is called a ductus arteriosus. So patent ductus arteriosus refers to those babies who are born with that duct open. It doesn't close. It's supposed to close. As soon as the child takes the first breath, it closes off. Yeah, because some chemicals are released in your body that cause it to close. Now, some children, it doesn't close.
Why doesn't it close?
It's just one of those things that happen. Yeah, it's one of the congenital problems. So a lot of times you have to go and tie them up. However, that said, nowadays there are new techniques which some procedures can be done without having to open your heart. We call them cath lab procedures, catheterization procedures. And one day we'll invite you to come and see what we do in the cath lab. You access the vessel through the vessels. Using small wires, you go into a vessel and either block or open a vessel. So even with coronary artery disease, a lot of colleagues who are in cardiology are able to go in and put a balloon, open up the narrow area and put a stent or something. And also for the PDA, they're able to go and close it.
So for the coronary artery disease, do you have to now go through the open heart surgery?
Not all the cases need open heart surgery, yes.
What cases need open heart surgery?
It depends on the age of the patient and the number of vessels that are involved. So we always have what we call a multidisciplinary team meeting where we sit with the cardiologists and the surgeons and we look on the canjo and look at the blood vessels and discuss the patient on a case-by-case patient basis, whereby the cardiologist will decide, no, this one I can sort out in the cath lab, we don't need you guys. Or if it's something that he feels, look, it's too tight or it's too near or it's got other complications like diabetes and hypertension, or is pretty young and has got a long life ahead of them, then we'll probably do a bypass, which is more definitive.
Okay, so roughly, what is the age that you can recommend for open heart surgery?
You see, we can't say we recommend an age because it depends on what you present with. For congenital heart surgery, at least we prefer if you come early. And it's so disappointing. A number of times, because of the nature of our country and poverty and issues, a number of times we've had to condemn people. Your mother brings a child, you look at a child and you're like, look, this kid, unfortunately, it's too late. The heart is too sick, and the only solution would be a heart transplant if possible. But there are times people stay too long with a heart disease, and they get very sick. Like the patient we were discussing earlier off the cuff, is a patient who came in but has been very sick. We think we can get them better, and I hope to invite you for that operation. We hope we can get them better. So they're in ICU. We're giving them drugs with a cardiologist and try to get them to move to get better in terms of the heart's function. When the heart gets well enough, then I quickly bring them to surgery. Then now they carry on with their lives. But you can get so sick that I'm not able to operate on you.
Okay, so doctor, you mentioned something about a heart transplant. Is it possible, like if I get a heart transplant, can I live my life as I used to?
A lot of people around the world are living normal lives with heart transplants, from pediatrics to adults. But it's a very, very resource intensive process. And there's still very few centers around the world that routinely do heart transplants. It's not a common operation. The idea is to avoid to get to the point where your heart fails so badly that you need a transplant. Yeah, but heart and lung transplants have been done around the world, but still not by very many centers.
And what are some of the things that you look out for when you are doing a heart transplant?
We don't routinely do heart transplants in Kenya. I think in Africa, it's probably only Egypt, in Cairo, and in South Africa, they're doing heart and lung transplants, both at in Cape Town and Johannesburg, I think. We're not doing them in Kenya routinely.
Okay.
Yeah.
Without further ado, we will take a slight commercial break, and I will leave you with the Did You Know segment. When you get back, Dr. is going to give us more details on the open heart surgery process.
Ways to take charge of your heart health. Schedule a yearly checkup. Get physical. Drink more water. Eat healthy. Control cholesterol. Cut down on salt. Quit smoking. Maintain a healthy weight.